Right. Hello, everyone. It's Kirstin Nussgruber here from Kirstin'sCancerCare.com. And today I have a really, really awesome guest to talk about everything and anything you want to know about CBD, cannabis, and medical marijuana. So those are three very confusing terms for many of you. And we have Dr. Mary Clifton here with us today. And I'm going to change this to gallery view so you can see both of us. There you go. And have a look at that. Okay. Let me chat. Okay. So there you go. Dr. Mary Clifton, if I can introduce you, you are an internal medicine doctor in New York City with 20 years of experience in both the hospital and private practice. And you are also licensed by the New York State Department of Health to provide medical marijuana, and you are a recognized expert in CBD, cannabis, and medical marijuana. You are a published researcher, national speaker on women's health and osteoporosis, and author of 4 books, 2 that are soon to be released on CBD and cannabis. What you need to know, how to use them, and even a cookbook to support ease of use. That I can't wait for that to become part of my extensive and ever-growing cookbook collection. Dr. Mary is also the leading voice in telemedicine to bridge the gap in healthcare availability and affordable lab testing for long-term wellness. Dr. Mary has previously served on the National Speakers Bureau for multiple women's health and osteoporosis pharmaceutical companies, including Eli Lilly, Amgen, and I hope I'm pronouncing this correct, Forest Pharmaceuticals, and Medtronic. Now, her passion is to not only help patients create a fast reset for their health and lives, but to support health practitioners to reset their practices and revenue through telemedicine and lab testing opportunities. So welcome, Dr. Mary. And I would like to kickstart our conversation today by maybe just giving us an overview of what is the difference between CBD, cannabis, and medical marijuana.
Well, it's a great place to start. When you think about the whole cannabis sativa, the entire plant, we harvest most of the drug from the buds and a little bit from leaves and stems. But within the plant, there are 80 different phytochemicals that we refer to as terpenes that are all different types of cannabidiols that have different effects within the human body. Of those, you know of THC, which is the one that has the psychoactive effect. It's the one that gets you high. And CBD is another cannabidiol that is in this combination of phytochemicals in each plant. The CBD is the workhorse of medical cannabis or medical marijuana. The CBD works for muscle relaxation, helping you sleep. It helps with a lot of the nausea, anxiety, where it has its basis in when we're using marijuana to manage PTSD and anxiety. So a lot of people can start with a CBD oil, which is a distillation, from the whole plant, and see if they get benefit from CBD if they're concerned about going forward with medical cannabis. Some people think, the studies support, and some people feel better when they get the entire bud or use the entire product in whatever mode of administration they choose to use. The entire bud has all of the different cannabinoids, all of these 80 different products, all of which have subtle different variations in the way that they behave within the human body. And people describe what's referred to as an entourage effect, that they got some benefit from using CBD, or they didn't really get what they thought they were going to get from CBD, but when they combined all of the different cannabinoids together, they got a different result. And the thing with medical cannabis is that you can shift and change which product you're using. If you want to have a different ratio of CBD to THC, if you want to go very low on THC, or if you're reading and thinking about a different cannabinoid and you want to try to see what the impact of using a product that's a bit higher on that cannabinoid will do for your system, then that's something that you can also do with medical cannabis that you can't do with CBD. And then, of course, there's recreational cannabis. So cannabis and marijuana are words that can be used interchangeably. And then using the whole bud in whatever strain you use for either medicinal purposes or for recreational purposes is what differentiates between what you would use for medical and recreational. Most of the time, people using a recreational product are using it to relax. So they would sometimes go with a higher CBD concentration, or they're using it to get high, in which case they're looking for something that's higher in THC.
Okay, so you really need to be in the hands or under the guidance of a practiced practitioner to understand the difference and to first of all, I guess, get access, because one of the big questions is it legal? Because we know in some states it is, and I think there's a lot of confusion about what is legal about it. Does the legality refer just to the medical marijuana? Does it refer to CBD as well? And could you maybe clarify that a little?
Oh, of course, CBD is legal across all 50 states. But however, with that said, even within states, within county to county within states, there's a different sense of the legal tolerance to marijuana and CBD. And even in states where marijuana is legal, I would say in Michigan on the West Coast, it's very, very reasonable to have marijuana and be using it medically. But on the East Coast, it's a little bit less tolerated. So you sort of have to know your region as well as the national and state rules. But with that said, CBD is legal across all 50 states. And you can order it, from many different purveyors online. You just want to be careful about exactly, who you're choosing. There was a JAMA study performed in 2017 where they looked at 84 different CBD preparations online and found that out of those, 26% had less drug than they stated they had on their label. 26% had less CBD actually in the tincture. So it's important that you know who you're working with and that you trust who you're buying from so that you get a really good, high quality product that you can trust.
That's such an important point because kind of the market seems to be flooded with CBD products. And I know that many of my clients lament that to me and say, I don't know which one to buy. I don't know which to use. I need guidance. Can you please help me out on that? So I'm just glad that you're shedding some light on this because people need to understand it.
Right? Very confusing to know what to buy. I mean, I think with anything that's grown and distilled and concentrated, I want to make sure that I've looked at the growers and looked at the way that the product is being grown, if it's organic or if they're using a more conventional sort of pesticide mechanism. I'm not sure I'm interested in that product.
So and that is out there?
Oh, certainly. Yeah, there's all kinds of soil companies and different ways to manipulate the growing conditions to maximize the productivity of the plants or make them, graduate to a mature status and be ready for use a little bit earlier. So all of those things are in place. It's just exactly what you're comfortable with for people to do. So I worry about the growers and the growing quality and the environment. And then I also worry about the distillation. If you're choosing a CBD, I want the distillation process to be very clean and not leave any chemical residue, any weird alcohols or solvents in my CBD. Mm-hmm. So the distillation process is very important too. And I think some of the thought leaders in this community, the really smart folks, are adding other products to the CBD to sort of maximize its potential. They're using a liposomal or nanosomal technology that allows the CBD to absorb even faster, because held in the mouth, the tincture should provide its benefit in 6 to 8 minutes. If it's swallowed, it behaves more like an edible, and then you're looking at something with a 60 to 90 minute onset of action. But holding it in the mouth with the adaptogen, with nano technology or liposomal technology, you can get almost instantaneous absorption across the mucous membranes. And people are adding other herbs. So if you're primarily using this for sleep, I know some really, next level CBD producers that are adding skullcap or all kinds of other herbs to the products to make them better for people who are trying to sleep. So those are really fun products to look out for too.
So they're very targeted products then for certain conditions, is what you're saying. And that was going to be one of my questions too. A question that I get a lot because I work with cancer patients is, can I use it, the CBD medical marijuana, can I use it, the CBD, because I have access to it? Can I use it for pain relief? And is it safe to use with my conventional treatments? And should I tell my doctor, my oncologist, about it?
I think it's a very good thing to do. In fact, my daughter is down at Duke. She's an OB-GYN down at Duke. And I just was the designated driver to take all of them to a music festival, her and some of her friends. And so I was in the car with my daughter and then with two oncologists. And we started
good.
breast cancer. And that's what they said. Everybody has questions about this, but definitely the CBD is going to be valuable in the setting of all kinds of immune problems. But a lot of the research done in immunology and specifically in cancer surrounding CBD and cannabis relates to the CB2 receptors. There's CBD1 receptors that are in the brain and the spinal cord primarily, and those get impacted when you get that THC high from cannabis. And the CB2 receptors are present all throughout the immune system abundantly on immune cells like macrophages and lymphocytes, but also within lymph nodes and the spleen, really loaded with CB2 receptors.
That's so important to know, to understand that.
Yeah. Your body already has those receptors there because we have endogenous cannabinoids, the anandamide and 2-AG that you automatically produce. And so this is stimulating a system that's already in place at a higher level, obviously, than your body can do with the existing cannabinoids in your body. But there appears to be changes with natural killer cell function, interleukin levels, tumor necrosis factor levels. I know your crowd is pretty savvy with all of these things. It's probably not stuff I wouldn't talk about on other podcasts, but also in the way macrophages and lymphocytes are stimulated, and in the way that these cells communicate with the microglia cells, with the cells that support immune function in the brain and spinal cord. So there's a lot of data surrounding immunology, and that appears to be the way that the cannabis works in the setting of cancer and trying to help, reduce recurrence of cancer or help to kill cancer when people are using it in those settings. But the CBD is also amazing for the chronic pain from patients who have suffered with neuropathic pain or have chronic pain from a previous surgery where there's this persistent painful stimulus that's constantly aggravating the ascending pathways and then, it amplifying and intensifying in the brain and then coming down through the descending pathways. There's CB1 receptors in all of those locations to help to reduce the inflammation and reduce the pain by using cannabis CBD. What
would be your kind of, I know there's you, in terms of what's your dosage supposed to be and what's the effective dosage for you going to, I know it's a very personalized situation. So what is your advice if someone wants to, obviously has access to CBD and starts using it, isn't necessarily seeing a medical practitioner, but is kind of trying it on his or her own? In terms of dosage and then starting off and to see when, how much am I supposed to take? When do I stop? What do I look out for? What is your advice?
I think that so many people give up too early because they don't titrate. You take a dropper full, it might not taste as good as you were hoping it would. And then it's not I'm not going to keep doing this. I didn't feel a thing. And so the, one dropper full a couple of times. In most of the studies, really in virtually all of the studies surrounding multiple sclerosis, pain, weight loss, and anorexia, the loss of appetite in the setting of cancer, HIV. In all of those studies, we start with a one dropper full, and then people titrate up. And in many cases, that takes at least 2 weeks. I mean, in most cases, by 2 weeks, people have titrated to where they've decided that it's working or it's not working. And it's not for everybody. About 10% of people across all the studies drop out. They either don't like the sensation of the medical cannabis inducing a high, or they just didn't feel like they got an impact from CBD. But that leaves a large number of people that really did feel better on it. And so titration, you start at one dropper full or whatever the minimum dose would be with the product you're given.
For the product, it depends on the product that you get. Yes. Mm-hmm.
And in some cases, people are going to 2 and stopping. In other cases, they go as high as 4 times the original dose, before they get relief. So that's really a good time to work with a coach or work with a practitioner and think about the titration a little bit more and try not to give up too early.
And what about long-term use? If they obviously now they're stuck with it, they found their dosage, that obvious, and then it also, I think, teaches people to become more in tune with their bodies, because they kind of listen in and see when is it effective. Is there a point where you kind of plateau and you'd need to titrate up even more? And is that safe to do? And what's the kind of the safest period to take it long term?
There is probably an upregulation to the receptors or a downregulation where the CBD being present for a period of time results in some changes. I just came across a study of patients who were in motor vehicle accidents, and then and it did appear, and I can't think of a good explanation for it other than upregulation of receptors. It did appear that those patients who smoked marijuana before the accident needed more opioids for pain management after the accident. Okay. But then there's other cases in chronic back pain situations. There was another study involving orthopedic surgery where the patients required less pain management. So it's a bit unclear. It may be impacting over the long term if you're in an acute pain setting to respond a little differently. But the question of dependency on cannabis, there's still a cannabis dependency syndrome or situation, but there's some argument within the literature that even exists. I mean, if you use this and you stop it, you're aware that you stopped it, but there isn't really a withdrawal symptom that you go through that needs to be treated, like when you're withdrawing from opioids. And we have great data across multiple disease states that you can reduce your dependence on opioids by 40% or more with the administration of cannabis or CBD. So it's really a nice product to add to your existing armamentarium for pain control and for anxiety control. And I like it because, it blurs the line a bit. You're getting pain control, but you also feel better, like you emotionally and spiritually feel better and calmer and safer. And I think there's just value in that really goes unrecognized. If there's a product we have that's safe to use, the amazing thing about cannabis is there's virtually no receptors in the brainstem, so it's almost impossible to overdose on it. It virtually never affects your heart rate or your respiratory rate.
That's such a good point to make. Really good point to make. Yeah.
So you can really relax and add it safely to everything else you're doing and see how you like it. And if you feel better, in addition to feeling better, I think that's a win.
Oh, absolutely. Especially when you've been suffering for so long. And again, you don't want to become dependent on prescription medication. You actually want to try and find more natural ways. So people ask me, are you using it? And I'm going to throw that question at you too, but I'll just also own up. I just to see the effect of CBD. But I was also, experimenting with it. But, I didn't really have a condition. I'm not suffering from chronic pain. I mean, I'm a cancer survivor. I'm a survivor of chemotherapy and so on. But I was really introduced to CBD at a later stage in that journey. So there was no immediate need for me to try and figure out, will that help a specific symptom? So I didn't see a benefit for me, but I just kind of experimented to see, do I feel something? What does it taste like, et cetera, et cetera. But I do know that if I would develop a certain chronic condition, that would definitely be part of my more natural regimen to try with, under the guidance of obviously somebody like you, or somebody who's just as trained and as expert as you are, just to get it right. And to fine tune it, make it optimal for me.
Yeah, we're trying to create some great products for people who want to start, but who, don't have, I mean, buying the CBD is expensive. And then trying to also get a medical professional to help with titration of a fairly innocuous drug can really add to the expense.
Yeah.
So we're creating some good products that will make it much simpler for people to do this on their own and really take control of their health. I mean, there's issues surrounding CBD and cannabis. I mean, as a medical doctor, my license trumps any other behavior that I do. I just, I mean, I just absolutely love to be a doctor, and I would never want to have that part of my life restricted or impacted in any way. But for everybody else, there's concerns about, limited scientific data. Has it even been studied in my condition? Do we even know if it works? So having that scientific data available at my website will be really reassuring for people. And then, is it legal? Of course, you have to know if it's legal in your state for medical purposes or for recreational purposes, and then, pursue the appropriate tools so that you can access legal medical cannabis. And then there's the social stigma of, being a grandmother smoking weed, or being the person in your church. All of these, I mean, nobody wants to put themselves in an environment where the people around them are questioning their behavior. And the social stigma still exists. Although I have to say, people I would never have imagined being pro weed are all of a sudden getting very pro weed. Like my 85-year-old mother, just when I talk to her, she's so amazingly positive and modern in her thinking. She's just wonderful. And then, of course, people don't want to get high. They don't want a dependency issue. All those things need to be addressed, but there's medical indication for multiple sclerosis, for God forbid, ALS or Lou Gehrig's disease, for the muscle wasting, weight loss, loss of appetite with cancer, HIV, AIDS, PTSD, and associated anxieties. There's lots of positions for this product.
Great. So before I ask you, basically, because from the sounds of it, you have that information available for the public, and I'd like you just to clarify that for us. So are you taking it on a regular basis, or at least the CBD?
You know what? Not regularly. Not regularly at all. I'd have to say rarely, because I just really don't have a
need for it.
No. Every once in a while my mind races at night, but I think that's true of everybody. And
you're right. You're so right. I had that night last night. I was awake since 2. So, but it's, if that becomes a regular occurrence, I would, have to do something about it. But you know what? It's actually quite normal that every now and then you just have a night like that.
I think it is normal, and I don't want to medicate myself into some sort of a pharmaceutical concept of normalcy. And some of those nights where my mind is racing, I really do sometimes come through with a breakthrough that I love. So I hate to but I don't have any position for recreational marijuana. I'm not in, I split my time between New York and Florida and Michigan, all of which are medical at this point, and I have no medical indication. But I love working with people who can think about this. I'm sure there's a lot of cancer doctors who haven't had cancer, or when I worked in osteoporosis, I didn't have
absolutely.
It's just an area that I love.
And it's also, I think the important point here is there's a need for it. If there is a need for it, it could help. It could help alleviate certain symptoms. And if there's no need for it, then it's not something to be played around with.
Well, it's
So
innovative. What I love about it is that it's innovative, even though it's 4,000 years old. There's stuff in
yes,
old Egyptian texts and Chinese
yes.
texts about using it for abdominal issues, for pain. So I love that it's old and new and very safe and innovative and a little edgy, and it allows the patient to take their care back into their own hands. I feel like everybody just runs to the doctor for everything and doesn't feel like they can manage and control their own health.
Yes.
This is a situation where if you're ready and if you want to take back the control of your health, I think you can in a lot of different situations. I mean, I was reading about inflammatory bowel disease where they took biopsies from inflammatory bowels and exposed them to CBD, and it cut their mast cell response in half, reduced a lot of their interleukins, and it's just amazing how effective it can be in reducing inflammation and cutting pain in so many different
So,
tissues.
so many different levels. It can really
Yeah.
have a great impact. And as you say, empower the patient to take back control and
Yeah.
become more familiar with their own process and their own body again.
Yes.
I know we can talk about this all day long. I certainly can, and I'm sure you
I
can
love
too. But
you.
I know you're also very, very busy, so I want to be very mindful of your time. Where can my tribe find you, and how, what kind of offerings do you have there if they want to take this further?
Well, if you're all of my free 3 to 5 minute videos that should cover a lot of the concerns that your tribe is thinking about are available at cbdandcannabisinfo.com. Just like my little garage of really great videos that I love, 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 that are quick and present the data in a way that's digestible and logical. I hope. That's my hope. And then we'll have some larger products that we'll be able to share, in some future emails. And then we'll send out maybe a great copy of the book and the cookbook. Do you think that your crowd would like that?
Oh, I certainly would love it. Yes, but absolutely. Yes, yes.
You.
This is such a novel idea. I would never have thought of combining a cookbook with CBD, but absolutely, yes, yes,
Yeah, there's so
yes,
many
please. So
great
once again, it
ways.
was CBD and Cannabis Info dot.
CBD and spelled out AND, CBD and cannabisinfo.com.
Okay, CBD and cannabisinfo.com. Okay, just wanted to repeat that again for everybody. And well, I just need to thank you now very much for coming on and sharing your beautiful wisdom and your hard worked for expertise. So thank you for illuminating all of us.
Oh, well, you're welcome. It was really a pleasure. Thanks for inviting me.
You're most welcome. So goodbye, everyone.
Bye-bye, everyone.